It's been estimated that 24% of the global health burden comes from environmental causes. Indoor air pollution, lack of access to clean water, issues of climate change, and what's that doing to the world's health. So we have 4 panelists to get us going on this topic. Like before, they'll each talk for 5 minutes. Then I'll throw some questions out, and then we'll open it up to you in the audience. Randy Kramer is professor in environmental economics and global health. Bill Pan is assistant professor, global environmental health. Subhrendu Pattanayak is associate professor, public policy, environment and global health. And Erika Weinthal is associate professor in environmental policy. And we'll hear first from Randy Kramer.
Well, good afternoon. As someone who works at the intersection between environment and health, I'm very happy that we can spend the next hour talking about some of these connections. I'm going to focus on malaria control, talk a little bit about connections to the natural environment, and then spend a few minutes talking about a research study that involves Global Health Institute and several other units here on campus. I think people in the audience here are very aware of the fact that malaria is a very serious problem in sub-Saharan Africa. It has been for a long time, very serious economic consequences. If you look at the more recent statistics, they're still fairly daunting in terms of over 750,000 deaths caused by malaria. But the good news is that number is 20% lower than it was in the year 2000. And this reflects really major scale up of international donor funding for malaria control and mass distribution of bed nets, drugs, and other interventions. What some people don't realize is that the environment plays a key role in malaria risk. Not only temperature and rainfall affecting malaria at the local level, but environmental management also influences malaria risk. Land use change, when we see deforestation, often there are increases in malaria, and certainly climate change in the future will be playing a role in malaria risk as well. So I want to talk, thank you. I want to talk about a study that we are involved in terms of building evidence for environmentally sound methods of malaria control. This is a study that we are conducting in central Tanzania, running some randomized health delivery experiments. And we're looking at 2 of the less well-known, less studied interventions for malaria control. One involves home-based healthcare using malaria rapid diagnostic tests. The photo on the left that looks like a USB jump drive is an RDT, rapid diagnostic test for malaria, gives an instant response. Local community health workers can go door to door, test people for malaria, and then administer drugs as appropriate. The other intervention involves the use of microbial larvicides to treat areas where mosquitoes are breeding. And for the global health students in the audience, this is a 2-by-2 study design with some villages getting the home-based healthcare intervention, some villages seeing the larviciding, some villages getting both interventions, and the final group serving as our controls. Just a little bit about our research design in terms of data collection, just to illustrate the multidisciplinary nature of our study. There's socioeconomic surveying to talk to people in the villages where the interventions are taking place to see the acceptance of the interventions. There's parasitological surveying, doing blood samples to test for malaria and anemia, and entomological surveying involving trapping of thousands of mosquitoes and checking the mosquitoes for the malaria parasite that they transmit. We're still in the early stages of this 4-year study, but we can draw a few lessons from what we've done. First of all, our initial work reinforces the multidisciplinary approach that we're undertaking. We have people involved from medicine, entomology, ecology, economics, biostatistics, decision sciences, and we're learning that that's absolutely critical for undertaking this type of study. Partnerships, again, are very, very important. We have several universities involved in the study, and most importantly, Tanzania's National Institute for Medical Research. Our focus groups have highlighted the limitations of the predominant approaches to malaria control. Certainly, the mass distribution of bed nets is absolutely critical for malaria control, but people don't stay under bed nets 24 hours a day, so we need other interventions to complement the existing control strategies. And finally, we are seeing bigger challenges than we had anticipated before in terms of how to make these alternative approaches sustainable. And again, it comes back to things that were discussed in the last panel where it requires different kinds of health workers doing different kinds of activities. So I'll turn the baton now to our next speaker.
Bill?
Wrong way. Oh. All right. In addition for this being the 5th year of DGHI, it's also my 5th month at Duke. And I have to say that even after 5 months, I am very excited to be here and being part of global health and building global health at Duke. And the Duke team is very good, and I have a hard time saying that because I'm not really I'm originally a Tar Heel, so it's hard for me to say that. So over the next couple minutes, I'm just going to give you a very broad view of what challenges we face in the Amazon. We also study malaria, very similar to what Randy just presented, so I'm not going to go over a lot of the research that we're doing because it's very similar. And if there was a mirror image, I'd be in mirror image, but in the Amazon and with a little bit darker hair. But so I actually want to start out by talking about something called the DPSIR framework. And this was something that was developed by the European Environmental Initiative and the National Institute of Public Health in the Netherlands. And it's a way for them to describe very easily and efficiently to policymakers what factors and what decisions result in certain impacts on human health or the environment. And so politicians need a very simple framework. So this was something very easy to present. So how this works for malaria, at least in the Amazon, and you don't have to pay so much attention to some of the bullets, but in the Amazon it starts out with drivers where you have something like road construction or oil exploration or gold mining, bringing in people to a region that otherwise was not inhabited, and you get a lot of land use change. And that land use change is some of the pressure that's occurring, and it's not only environmental pressure that's changing the environment. You're getting a redistribution of different anopheline species that exist locally, and you also have a new population coming in either temporarily or permanently working in an area, and that results in our impact, which is really greater exposure to malaria for people and greater number of incidents and prevalence in the region. And the responses, which can be from a policy perspective by the government, such as increasing the amount of health care that's available in different regions of the Amazon, or it can be a much more distal response, like an oil company or a logging company deciding to take resources from another area, or increasing the amount of resource extraction in another area. So that's kind of how, in very general terms, how the malaria epidemiology works in the Amazon. So some of the challenges we have, and these are not going to be very different from what Randy just presented, but just a little bit more specific to what's going on in the Amazon basin. The big one that we have is about the incipient construction of roads and infrastructure expansion in the area. So you can go from a newly paved road to, a newly cleared road to a newly paved road very quickly. And that can be into a new area that was not previously inhabited, that brings a lot of people to the region. You also get a lot of mobility, and that's different from migration. You get permanent migration out, usually out of the Amazon or into another country, but you also have population redistribution where people might go work in an area for a short period of time and come home. And they're being diagnosed at home, and you think they're being affected at home, and that's where their risk is. But in reality, their risk is away from their house. And tracking them can be very difficult. The other real challenge, which is a challenge in any public health study, is making sure you have good data. And I consider this a problem in the Amazon in particular in comparison to other countries that I've worked in Africa, because we don't have a lot of good cell phone coverage. We have very good partners that we work with locally, but the problem is that we're going to very remote areas where there are no established communities. And so making sure that people are following protocols of data collection can be difficult. So a lot of times you have to go there yourself and make sure the data is being collected and you know what types of data are being collected, so when you analyze it, you can make a proper inference. The other problem environmentally is that there's a lot of variability in the Amazon in just soils and water. So modeling that in the traditional way that geographers would model it with remote sensing can be difficult because you're limited to the amount of the scale at which data are given you environmentally. So the last two challenges really relate to what Randy was concluding, and this deals with the complex modeling that is really involved in trying to establish a causal relationship. So a lot of times I deal with population movements, entomologists, and infectious disease. So we've got economists, demographers, sociologists, entomologists, all trying to contribute to a statistical model. So you need good statisticians, you need good mathematical modelers, and getting everybody together is a hard thing, and getting everybody to say that, okay, we only need this one or two variables that are really important. We don't need these 100 other things to model things to make sure that we're getting a right inference, but we need the most two important things in this model to predict something. And that's really what the hard part is. And that's kind of what I'll conclude with, and I'll give it to Subhrendu.
Is this on? Yeah. So what Bill didn't say was that the bigger challenge was that a biostatistician from Duke collaborating with a demographer from UNC or something like that. So I could have talked about malaria as well. It's one of the clearly one of the most environmentally based health problem, but instead I'm going to talk about cook stoves as a short form for energy choices made by half the world, literally, and that the fact that you're burning crop residue or dung or wood, and you're burning it inefficiently, which leads to air pollution that causes health effects, but also environmental effects. And guess what? It changes the climate. So in a sense, this new initiative that Duke has launched with DGHI is an example of the 4.0 that Peter was talking about. It completely exemplifies that. I mean, when he was going through his matrix showing how things had changed from 3.0 to 4.0, we could have gone check down all those columns, and my brains aren't working well enough for me to remember all the things he went, but you could have seen that. Hopefully it'll be exemplified. The other reason to work on this is whenever Martha Stewart and Hillary Clinton and Julia Roberts and the New York Times are talking about something, it's probably something that you should be paying attention to. So clearly there's a lot of attention to this issue of getting people who've been cooking in one way to change their behavior. It's not just me insisting on this. Obviously there is the health effect. There's lots of people concerned about respiratory health, but I need to talk to Gerald about cardiovascular implications of pollutants sort of sitting in the bloodstream and in lungs. The reason this has sort of brought the Hillary Clintons of the world to the table, and Martha Stewart, important person too, and Julia Roberts, is that everybody knows that CO2 is a bad thing. We've all committed a sin this today, coming to this workshop in some ways by driving or turning a light on. But everybody else out there who's burning, using a dirty stove to burn a dirty fuel is emitting something called black carbon. That's just basically soot. And that's it's the third worst thing that you could do in the climate change world in some ways. Okay, so one of those red columns is black carbon. And this affects not just climate in a broader sense, but if you care about certain parts of the world, like the North Pole, it has a huge impact in terms of melting the glaciers there. And if you care about the Himalayan water system, which feeds say 25% of the world's population, because all these streams are coming off that, then there's a problem as well. Okay. If that wasn't bad enough, lots of the wood and the dung is sort of harvested at a rate that's worse than it's generating. So the forests are declining, so people who care about birds and species of other kinds and watershed services and ecosystem services, they're upset as well. Okay. And finally, when the forest declines, most of us didn't have to sort of haul our fuel for our breakfast from anywhere. But that declining forest quality clearly affects the women who have to then walk further and spend an hour, 2 hours. Just think of anything that you spend 2 hours on today. If that went from 2 to 3 hours, how that would affect your life. Okay? Having said all that, the hard science that most of us are used to is sort of reasonably limited on this. And many statements that I made, if you wanted to get that through a peer-reviewed process, would be questionable because we don't have evidence on all the things that I just said. So there's lots of open questions. And people on campus have sort of taken on a lot of this. I won't go through the list of papers that we're working on, but I'll just highlight a couple of studies that we've sort of launched, looking at the demand side with Jessica Lewis here, trying to understand why is it that people do this silly thing that apparently is so easy to solve. Well, it's not quite. And in a review, we find that they're the usual suspects. People don't have the money, they don't have the right education, they don't have the right place, but also careful intervention studies have not been designed around this question. Turning to the supply side, you have the usual suspects. Institutions, governments, surprisingly, are much more effective than NGOs in sort of scaling up. And also, at least they're targeting the right places. And at the end of the day, something else that we've been studying is that, partly reflecting what Peter was saying about the challenges of 4.0 and the many unknowns in environmental health, it sounds like there should be lots and lots of exciting programs that can promote stoves, and the Clintons of the world and the Julia Robertses are doing the right thing. Yet, because there are major technological challenges, a $50 stove is still not worth it in some ways. And so we need technological breakthroughs, we need biomedical breakthroughs, and we also need, above all, behavioral understanding of what's going on to be able to show that the programs that we can push will ultimately sort of pass the cost-benefit test. It's a very new initiative, and so stay tuned.
One more. Okay. So I will preface this by that I'm probably the only one on this panel that cannot talk about malaria today. And so, okay, so in thinking about this panel, what struck me was that this is about global environmental health and the relationship between the environment and health. And where I really fit in probably is in my research that looks at the role of political institutions. And so what I'm going to be highlighting in some ways is that how the environment affects health is often mediated through the role of political institutions. So as the morning panelist said, she has no interest in being involved in politics. I can't stay away from studying politics and the role of the political process. Okay, so what I'm going to be talking about today is some of the work that I've been doing in the realm of looking at how water is managed in countries that are emerging from conflict, and particularly violent conflict. And just to begin, when we think about the environment in conflict, it's a subject that has only begun to get a lot of traction, especially in the high political echelons. Often when we talk about the environment, there's this notion that this is the realm of the tree huggers and not the realm of those that work on peace building within the United Nations and peacekeeping missions. But when you look at what has taken place since World War II globally, and you look at the large number of armed conflicts that have taken place, not only are many of them internal, where we've seen a shift from interstate conflicts to internal and in the developing world, but over the last 60 years, at least 40% of all intrastate conflicts have had a link to natural resources. And since 1990, 18 of these conflicts have actually been fueled by natural resources. So in some ways, natural resources are very much political. So this part of what I've been working on is a project through the United Nations Environment Program, where over the last few years I've served on an expert advisory, part of an expert advisory group for a particular division within UNEP that deals with post-conflict and disaster management. And what has emerged from this advisory group and some of the programs taking place there was a need for empirical evidence and lessons learned from all the activities that are taking place among a large array of actors involved in post-conflict peacebuilding that work on natural resource management. So I have been involved in editing a volume on the role of water, and what we've tried to do in this volume is to tease out lessons to try to understand, one, how natural resources, here particularly water, is linked to conflict, but more importantly, what are the risks to post-conflict peacebuilding if those key actors who are involved do not address natural resources. And this provides, it's an entry point into the traditional post-conflict script, because if you look at how conflicts are managed internationally, often the first thing that takes place is disarming militants, convening elections, thinking about economic restructuring, but natural resources are often pushed aside. And what we have been arguing and trying to demonstrate with case studies from across the globe is that natural resources need to be integrated into every particular entry point along the post-conflict spectrum. So just to give one example of why this matters is, if you look at the post-conflict spectrum, it often goes, and this is sort of a crude understanding that this is a spectrum, but things often go forward and then move backwards, and it's not very linear. But often we start with these immediate humanitarian interventions to deal with the situation right when conflict ends, and then try to move to to development. And in humanitarian interventions, what often or in the some of the challenges for humanitarians is that, one, when conflict ends, there's an assumption that things will get better, lives will improve, but if you look at the data, often the risk of dying from exposure to infectious disease related to poor quality of water and sanitation increases after conflict ends, and this can be seen in the DRC, where almost half the deaths that have taken place took place after the end of the conflict, and that's the Democratic Republic of Congo. And then, just to conclude, I just want to give one more example of often, even when we have a good understanding of what's taking place, often good intentions can lead to unintended consequences. And in Afghanistan, again, after the conflict, or when there was, I should say early on, when there was an assumption that we were moving towards a post-conflict peacebuilding period, there were interventions that were taking place to try to provide water, clean drinking water. And in the absence of having good knowledge, again, of political institutions, social institutions, water management, what took place was emergency deep well drilling actually undermined what had been a very traditional system of water management in Afghanistan based upon this Karez form of irrigation. And so good intentions there actually led to new forms of conflicts emerging among water users. And I will leave it there and turn it over to our moderator. I don't know which one.
So I'm going to kick off with a few questions. Be thinking of your questions. Again, I encourage students to feel free to chime in. So, I mean, this is a fascinating area, the impact of environmental change on health. And I'd like you all to think about 50 years from now, all right? Climate change possibly continuing, population growth continuing, increased pressure on our resources, on the forests, on water. What things would you like to see being done now to make sure that in 2060 we're not where many people are predicting we're going to be in terms of health, in much worse shape than we are now? What steps could be taken based on what you're seeing with water in conflict, with what's being done on fuel use for cooking, with what's being done with managing habitats to ensure a better 2060? Yeah.
So one reason I'm not presenting on water and sanitation or malaria is, and Duke's sort of interest in the cook stove work is precisely this link to forward-looking behavior in terms of climate. So for most of these other infectious disease challenges, deteriorating climate conditions will make things worse. What happens in the case of cook stoves is it's part of the solution, just like we are trying to convince lots of people to change their behavior or looking for technologies that will change emission rates. This is the potential win-win where in trying to solve a classic health problem, you are actually addressing and buying time for more permanent solutions in the climate space because it reduces the emissions of this short-lived species, let's just call it that, particulate matter, and you can have an impact within 2 to 4 weeks, as opposed to CO2, where you have to take an action today and 200 years from now, you will see a change in the stock. Whereas particulate matter can go down, and in a sense, it buys us time. This doesn't mean that this is the only way to solve the climate change problem, but it is an important one. And guess what? Incidentally, you get rid of a major health problem, and that's why this is sort of a unique opportunity that has kind of sprung forward.
Erika, you were talking about post-conflict water management. What about pre-conflict? Are we running out of water? Is it inevitable that we're going to see water wars? An easy question.
No, that's a question everybody loves to throw out, and I mean the simple answer is water wars in the way they're conventionally conveyed, that these will be wars between states. I mean, no. There is no empirical evidence that states have ever gone to war over water. But what is more likely to take place are more small-scale conflicts at the local level over access to water, over access to good quality of water. So again, the changing nature of the conflicts we'll see a changing nature of conflict, but this isn't something that's going to be these all-out wars that are often conveyed, where the next war will be over water in the Middle East.
Malaria habitats over the next period of time, increased pressure, climate change. Is it going to make it worse, or are we going to lose habitats for some of these mosquitoes? Is it just going to be different?
Well, that's been a subject of quite a bit of research over the last 5 years, and what has triggered some of it is the observation that we're seeing increasing rates of malaria in some high elevation areas in East Africa. And so the question has been, is that due to the climate change that's already going on, or is it something else? And that's been really debated heavily in the literature. The most recent analysis I've seen, that's sort of a meta-analysis of all the other studies, suggests that climate change is already leading to increases in higher elevation malaria, but it's a complicated story. It's part climate change, it's part migration, it's part land use change. Now looking out 20, 30, 40 years, most of the projections that I've seen show a change in areas where malaria is prevalent, but also a fairly dramatic increase in the number of people exposed to malaria.
Bill, you paint a bleak picture there of increased pressure on resources, forests being cut down, people coming together who weren't before. With population growth, is that an inevitable scenario?
So I would say that one of the things that has to be done says in 2 weeks we'll hit 7 billion people on Earth. When you talk about malaria rates, I think you have to really understand what the underlying population at risk is, because a lot of times you're calculating malaria incidence based on number of positive cases divided by the number of slides that you actually took instead of the number of people that live in an area. So you could actually play with some of the numbers and the statistics and make it seem that some cases are going up or down. But I think you have to be careful about, I think climate change will increase the number of people that are going to be ill with malaria, but I think we also have to pay attention to how many people we're actually talking about. What is the denominator? And I don't think we have a good grasp on how to calculate the denominator in a good way in areas that are not very population dense.
One of the challenges in public health is sustainability and scalability. And a number of you talked about interventions or innovations that could have great promise for health. The rapid testing for malaria in people's homes, a cook stove that isn't generating the same gases. What needs to be done to get these kind of innovative solutions to larger populations? Do we have it yet, or do we still need new innovations to bring the cost down?
So certainly if we can bring the cost down, that's going to be important. I guess the thing I worry about the most in terms of sustainability of our current attention to global health, not only in the environment area but other areas as well, is just the political commitment to continuing to support global health programs. In the area where I work in malaria, we're spending about $1.5 billion globally on malaria control efforts. About a third of that comes from the U.S. President's Malaria Initiative, $500 million a year. It's hard for me to imagine how we're going to be able to maintain political support for that level of funding going forward.
I would say that, so most of my research is in the Peruvian Amazon. When you ask people, would they be willing to spend $3 or $4 for an insecticide-treated net, everyone says yes. When you ask them if they got one of the WHO insecticide-treated nets, there were 200,000 given away, nobody in my study site, which is about, I would say about 500 households, got one. So I don't know where those nets went to, but the people would be willing to pay for it. And the technology exists.
Subhrendu?
I mean, so sustainability and scalability is the point of entry for at least the kind of cook stove work that we're trying to launch here. Through some of the initial analyses that I've shown is more sort of review across multiple studies and not just one idiosyncratic study in a particular location or setting. And I think part of understanding the scalability and sustainability, so there's 2 points. One is that as researchers, we have to take a much more non-interventionist, very narrow, trials-based approach, because the world that we are going to, I mean, 3 billion is a hard target to hit with a study from northern Ethiopia. That won't provide you all the answers for that place, and so we've got to take a much more population health-based assessment, which might involve some compromises on the sort of the precision of the science. But the other thing in the cook stove world, which again is tied to this climate argument, is that it's a new infusion of money to an old health problem. Compared to some of the other health issues, carbon finance is actually money that the health world had never seen. And this jointness of global environmental challenge as well as a dominating public health problem has sort of brought new money, and that, money always buys you something. But this is not to say that institutions are subservient in any way.
Sure. I would separate sustainability from scalability, and largely because in the water sector, there are multiple solutions to the water problem, and we also need to think about the urban-rural divide, because solutions that might be appropriate for rural communities may not work in large urban centers, and those that are often proposed for large urban centers may be not appropriate for rural communities. And so scalability is a tricky issue, because if you want that one solution fit all that you can scale up, that is something that is not appropriate when we talk about, dealing with water shortages in the future.
I'm going to ask the panel one more question and then throw it open to the floor. So why should Americans care about this at all? You know, there are so many health problems in this country. There's so many things that Congress is trying to deal with in terms of the budget. They're trying to cut the debt. Why should Americans urge Congress to invest at all in global environmental health issues?
My biggest reason would be that dengue fever, for example, which is classically a tropical disease in urban environments, is encroaching on our borders. If you go to parts of Texas, Alabama, Arkansas, you can find cases of dengue, not very many, but as the temperature increases and it can sustain Aedes aegypti in different environments, and Aedes is the mosquito that can spread dengue, I mean, changing environment means that political borders don't matter. And that's the biggest reason, I think.
Self-interest there. These germs travel. They could be coming
I think
here.
that's the only way to get people motivated.
Okay. Others? Erika?
I mean, it's not, why should we care? I mean, even if you take the countries that are emerging from the Arab Spring today, many of them, one of their first priorities is going to be to rebuild their basic services. And I mean, from a foreign policy security perspective, we would like to see peace and security in that region. And you know, it's not going to emerge without addressing basic services such as water and sanitation to try to restore livelihoods and a sense of confidence in their governments, especially governments that for decades were the sole providers of these basic public goods.
So a real national security interest there. Randy?
Yeah, just to reiterate what Erika said, I mean, I think improving health reduces poverty, and I think poverty reduction decreases conflicts.
Subhrendu?
So, yeah, I can't deny either one of these arguments. So, to a public health crowd, the health disparities argument is always going to be compelling, but you all know that you're strange people and the rest of the world is not strange, and so you've got to convince them. So for the non-strange people, what I've been trying to say is that, I don't know, this thing is not working, but that little red bar, it's a completely selfish argument. If you want to leave your lights on and drive that SUV for 15 minutes longer, why don't you convince a bunch of households in Africa to stop using the kind of stove they've been using and switching to this? It's just going to buy you 20 more years of peace in your mind because you've tried to save the climate problem.
All right, with that, I'll open it to all the weird people who are here from public health. Yeah, I mean, that last question comes from the fact every time we do a global health story on ABC News, our website is flooded with the comments, we have problems here too. And it's something that when you're in a room of believers, it can be difficult to articulate why these issues matter. But it's really important that we all don't take that for granted, because as decisions are made at the policy level of what to fund, global public health is an easy one to cut, because there's not a lot of people who are going to be up in arms domestically. If you could introduce yourself, your name, and your affiliation.
Hi, Jerry Bloomfield, Duke University. So what strikes me about the environment and health is that it's really, cuts across many disciplines in a way that sort of the biomedical sciences just don't. And one of the other disciplines that it cuts across, and as I've seen it, is sort of the cultural sphere. Someone's environment, especially in many low and middle income countries, is directly related to their culture for a lot longer than here in the U.S. perhaps. And so my question is, in your work or in your research, how do you take into account the deep feelings that people have about how they've prevented malaria for hundreds of years, how we've always procured our wood? I was at an NIH panel on indoor air pollution, and one of the reasons that they said that we should do something about cook stove is because it was clearly impacting women and children, and they would therefore have more time for leisure activities or non-work activities. And one of the other comments was, well, what do their husbands think about that? maybe that's something that they don't necessarily want for their family. So there's just an example of how sort of cross-culturally these things are, and I just wonder if, how you've thought about that in your own research.
So I certainly agree with you that involving a variety of social sciences is so important in terms of figuring out solutions and how well new solutions will translate across cultures. In our work in Tanzania malaria, we have medical sociologists involved who are really leading the consultations with the communities and determining what works and what doesn't work. And some of the things that we went in convinced would be very workable have run into some very serious cultural barriers. And so we're rethinking our design as we go. And I think that's absolutely important as we move into other cultures and work with people from other countries.
In I have a paper called Shame or Subsidy. This is in a sanitation context, and the idea that culture is sort of central to behavior change is, it doesn't take. It's obvious, but what is I think in this sense, what Peter was saying about this 4.0 vision of global health is fundamentally important, where the PIs and some of the partners are out there. And this is why the one-size-fits-all concept that Erika was saying is weak will never work. So, and why our solutions cannot be sort of this vaccination-based. There's 3 pills, you take them on this day, and you take the injection on the 6th month, and then that's it. The stoves have to be different in different settings. The fuels that people will burn are different because the foods that they're cooking are different. And to have the straitjacket solution will never work. And so I think, yeah.
Over here.
Yeah. I'm Herb Siegel. I describe myself as a retired malariologist. I'm very interested in one of the economic changes that has not been mentioned today, that is increasing urbanization. That together with vectors taking new ranges, novel vectors with heretofore unknown biting habits appearing. What is the prospect for urban malaria in the next 50 years in many of the major population centers of the world?
I'd like to take that.
Well, I would say in the Amazon, that's a relatively easy answer, only because, at least in the Peruvian Amazon, there is no malaria in the urban areas. Anophelines don't exist there that can spread malaria. All of our research in Iquitos, which is in the northern Peruvian Amazon, we do very intensive mosquito collections every 3 weeks. We've done it for several years, from 2000 basically to right now. We work really closely with the U.S. Navy Medical Research Unit that's there, and we've never found anophelines in the urban area of Iquitos. The closest we found it is within about 30 kilometers of the city center. There are malaria cases. The problem is we've never linked it, we've never had a study that actually could do the genotyping to link sporozoites found within a mosquito to the malaria that you find within a human. And if you're a malariologist, you probably know that's a really difficult thing to establish anyway. So, I mean, I can only speak really of the Amazon context. I don't think that urban malaria would be a problem, but we're actually started a study with my postdoc, Beth Feingold, as well as collaborators at UNC and Hopkins, Johns Hopkins, where we're looking at this idea of dual burden of disease in the southern Amazon, where we have dengue fever, which is very urban, and malaria, which is very rural, and we have data that's collected across an array of rural and urban areas. And we're trying to add on mosquito collections so we can actually identify where the divide between the mosquitoes occur, and is there competition for the habitat there, and if there is competition, then we say something more about what diseases they're going to be susceptible to.
Subhrendu?
I think Bill touched on the point that even though I don't know much about urban malaria, dengue fever is certainly something that is giving lots of people lots of sleepless nights. And although that mosquito bites in the day. Right? The other problem here, I think what urbanization introduces is this artificial split between chronic versus infectious disease. In urban slums, everything comes to a head and you've got just a cocktail of problems. And I think it's certainly something, as was being discussed in the opening remarks, that we haven't done a great job of sort of addressing, because we separated rural, urban, chronic infections.
Hello, my name is Praveen Raghunathan. I'm an undergraduate senior. My question is kind of related to what Dr. Besser just posed to us before we started on this new topic. One thing I was wondering is if you could comment on what is the responsibility of everyone in this room in regards to global environmental health challenges. In particular, when thinking of natural resources in conflict zones, and you mentioned the DRC, everyone in this room owns a cell phone, and the conflict minerals is the new, the new blood diamonds, with tantalum, tin, all these, minerals in our cell phones, and we might be fueling, one of the worst conflicts since World War II. If you could comment on that, and in addition to the other ways that us as Americans are contributing to the global environmental health challenges that we're facing.
I guess I should take the lead on that one.
Good question.
No, the question raises a really interesting point about thinking about natural resources more broadly and their health impacts even more broadly, in the sense that we're dealing with large commodity chains, and so there is a need for better understanding of these commodity chains and who the actors are involved across the commodity chains and who is affected. So often in many post-conflict countries, the conflicts that often have fueled natural resources are the high-value resources. They're not water. It's the gold, the diamonds, the minerals, and it's often the most disenfranchised, the poorest, who extract them, and they work in conditions that have detrimental consequences for their health. And so those links can be made and should be made across the whole commodity chain. And one of the goals of the project that I'm working on, that also has a volume on high-value resources, is to think about how corporations can change their behavior, how governments can change their policies through certification programs, but that what are the interventions that could take place?
Ready?
Besides our cell phone purchases, the other ways in which we affect these problems that we've been talking about is just our daily lifestyle choices in terms of our own contributions to climate change. And if you look at projections of the effects of climate change on global health in the future, it's not just increases in vector-borne diseases that we've been talking about here, but increasing problems with water availability, greater food insecurity problems, increased flooding leading to deaths and injuries. All of these things are affected by the choices that we make. So we can make both lifestyle choices and political choices that can influence the future of those diseases.
Dennis Clements, Global Health Institute. You've spoken about the water problems, and I agree completely. I think everyone has a water problem. Many don't know it. Southern California is in big trouble, as Arizona. The air pollution has been probably mostly by the U.S. for a long time, just because of how many vehicles, et cetera, and there's lots of laws that try to restrict pollutants. But China is expanding astronomically in its economic power, its ability to buy cars, et cetera, and could, I think, have a much larger effect in the long run than anything we do here. Do you see this as something that needs to be taken into consideration in looking at the pollution problem?
Yeah, so again, part of the way we have been programmed to do research, we've over-specialized, and environmental health forces you to under-specialize in some ways and sort of take on these very broad questions. And one of the over-specializations has been the artificial separation of outdoor air pollution, as if it's something we're all walking in our bubble and sort of never run into that thing out there. The indoor air actually becomes outdoor air. So to some extent, the cutting edge, when I said that there are many unknowns about the kinds of things we were sort of discussing, one of the big unknowns is what part of those respiratory health and cardiovascular health issues are due to what the mother inhaled while cooking, as opposed to when she stepped out. And to what part, so for example, cook stoves are part of the black carbon problem, but so are brick kilns, which are all over the place, and small factories, and as well as the use of diesel, not the kind that you and I would if we drove a diesel car. But so I think to some extent, because there is a technology that people have sort of honed in on, that there is a pot of gold at the end of the rainbow that they're all sort of running after, but clearly we've kind of forgotten about the older ambient exposure, which is also getting much worse, and the science is not very clear on that at all.
Just to pick up on the China part of Dennis's question, there have been at least a half dozen studies that have come out in the last 2 or 3 years documenting the extent of the health burden that's resulting from air pollution in China. And I think partly as a result of that research, the Chinese government is now putting priority on addressing environmental health issues, both in terms of research, but also starting to think about policy actions to reduce air pollution. And certainly we get a lot of inquiries from Chinese academics wanting to partner with us on environmental health issues related to air quality.
Well, I want to thank our panelists for a very interesting discussion.